My contribution to Rural Healthy People 2030 was the cancer chapter, and I was the lead author for that. Based on my background, I'm an oncology nurse and have been that for my entire career for the last 23 years. And so I'm really passionate about oncology. And as a nurse, I've seen a lot of patients who've had to travel very far to come to major cancer centers to be treated, and they're away from their family, their support systems. I really wanted to explore how that is happening for our rural folks in the United States. How can we improve care for them? And so focusing on this chapter, we really focused on what were the disparities, and then also what are the opportunities and what are the things that we can do and work on for the future. The thing that was really surprising to me was the lack of rural specific strategies in the cancer control plans that each state has. So every state is required to have a cancer control plan, and most of them will at least mention rural, but very few of them actually have any strategies in place that they're actively working on. And when we were exploring this chapter and found so many disparities, especially with control and treatment, it's not surprising when there isn't really a strategic goal around it. Sometimes we have to remember to focus our goals on the things that are really important so that we can actually improve access for those rural patients and make things better for them. By 2030, what I would really like to see happen based on a lot of what we saw and found. So we saw some really good trends with cancer mortality coming down across the board for most cancers, even in the rural areas. But one thing I think I would really like to see happen is more research and more programs that address how do we improve access to treatment and survivorship for our cancer patients. There's been a lot of work with screening. We're working to get more and more family practice people and oncologists out into those rural areas. But how do we then make sure we have sustainable programs that can support people for the future? So I'm hoping by 2030, we're going to see more work done in that area, and we can see the mortality come down even more to be more in line with what we're seeing in urban and metro populations.